hair loss. It's a concern that affects millions of people worldwide, men and women alike. The gradual thinning on the crown, the receding hairline, the widening part, these are all too familiar signs of a condition that can impact self-esteem and emotional well-being. While hair loss can be attributed to various factors like genetics, aging, hormonal changes, and medical conditions, the quest for effective treatments has been ongoing, offering both hope and hype along the way. For many, the realization of hair loss can be distressing. It can feel like a loss of control, a visible reminder of aging, or even a blow to one's sense of attractiveness. The good news is that the field of hair loss treatment is constantly evolving, with new discoveries and innovations emerging all the time. From FDA-approved medications to cutting-edge clinical therapies and promising DIY solutions, there is a growing arsenal of options available to those seeking to combat hair loss and regain a sense of confidence. It's important to remember that not all hair loss treatments are created equal, and what works for one person may not work for another. Individual responses to treatment can vary based on factors such as the underlying cause of hair loss, genetics, overall health, and lifestyle. This is why it's crucial to consult with a qualified healthcare professional or dermatologist to determine the best course of action for your specific needs. For years, the battle against baldness has been fought with a limited arsenal of treatments. Two medications, minoxidil and finasteride, sold under the brand name Propecia, have dominated the market as the only FDA-approved drugs for hair loss. Minoxidil, available in both topical and oral formulations, is a vasodilator that widens blood vessels in the scalp, promoting hair growth. It is considered safe for both men and women, and is often the first line of defense against hair loss. Finasteride, on the other hand, is a prescription medication specifically for men. It works by inhibiting the conversion of testosterone to dihydrotestosterone, DHT, a hormone implicated in male pattern baldness. While effective for many men, finasteride has been linked to potential side effects including erectile dysfunction and decreased libido, which has led some to seek alternative treatments. These traditional treatments, while effective for some, have their limitations. Minoxidil needs to be applied consistently to maintain results, and hair loss often resumes once treatment is stopped. Finasteride's potential side effects can be concerning for some men, and it's not suitable for women. Furthermore, both medications primarily target the symptoms of hair loss rather than addressing the underlying causes. This has led to a growing demand for more effective, long-lasting, and less invasive solutions. Fortunately, the field of hair loss treatment is rapidly evolving, with promising new therapies on the horizon. For those seeking a more permanent solution to hair loss, hair transplantation has long been a viable option. This surgical procedure involves harvesting hair follicles from a donor area, typically the back or sides of the head, and transplanting them to the balding or thinning areas. Hair transplants have become increasingly sophisticated over the years, with techniques like follicular unit extraction, FUE, offering less invasive and more natural-looking results. The global hair transplant market is booming, projected to reach a staggering €24 billion, $28 billion, by 2027. This surge in demand reflects the growing acceptance of hair transplantation as a safe and effective treatment option. However, it's important to note that hair transplants are not without their drawbacks. The procedure can be costly, ranging from a few thousand to tens of thousands of dollars, depending on the extent of hair loss and the technique used. It can also be time-consuming, often requiring multiple sessions to achieve the desired density and coverage. Furthermore, some patients may experience pain, scarring, or an unnatural appearance, especially if the procedure is not performed by a skilled and experienced surgeon. Despite these limitations, hair transplantation remains a popular choice for many individuals seeking a long-term solution to hair loss. As technology continues to advance and techniques improve, we can expect hair transplants to become even more refined, offering patients even more natural-looking and satisfying results. While traditional treatments and hair transplants have their place in the fight against hair loss, the future holds exciting possibilities with the emergence of novel pharmaceuticals. Researchers are constantly exploring new avenues to combat hair loss, and several promising drugs are currently in development or have recently received regulatory approval. One such drug-making waves is Breezula, a topical DHT blocker specifically designed for women. Early clinical trials have shown promising results in promoting hair growth and preventing further loss in women with androgenetic alopecia, the most common type of hair loss in women. While more research is needed to confirm its long-term safety and efficacy, Breezula represents a potential breakthrough in treating female pattern baldness. In the realm of autoimmune hair loss, specifically alopecia areata, 2 JAK inhibitors, Olumiant, baricitinib, and Litfulo, ritlecitinib, have garnered significant attention. These medications, initially developed for other autoimmune conditions like rheumatoid arthritis, have demonstrated remarkable efficacy in regrowing hair in patients with alopecia areata, even in severe cases. Olumiant received FDA approval in June 2022, followed by Litfulo in June 2023, marking a significant milestone in the treatment of this often devastating condition. However, it's important to note that JK inhibitors can have potential side effects, including an increased risk of infections and cardiovascular events. Therefore, they are typically reserved for patients with moderate to severe alopecia areata who have not responded to other treatment options. As with any medication, a thorough discussion of the risks and benefits with a healthcare professional is crucial. Now let's delve into some of the most innovative clinical treatments available today. These advancements are revolutionizing the way we approach hair restoration, offering hope to many who have struggled with hair loss. From laser therapy to advanced PRP treatments, the future looks promising, so stay tuned as we explore these groundbreaking therapies. When it comes to hair restoration, there are numerous accessible options available today. From over-the-counter treatments to professional procedures, individuals have a variety of choices to suit their needs and budgets. It's important to consult with a specialist to determine the best course of action tailored to your specific situation. Understanding the key ingredients and nutrients that promote hair health is crucial. Many treatments focus on vitamins like biotin, minerals such as zinc, and other essential nutrients that support hair growth. Incorporating a balanced diet and supplements can significantly enhance the effectiveness of hair restoration efforts. Effective treatment strategies often involve a combination of methods. This can include topical applications, oral medications, and even lifestyle changes. Staying informed about the latest research and advancements in hair restoration can help you make well-informed decisions about your treatment plan. Embracing advancements in technology and personalized care is key to successful hair restoration. With the advent of innovative techniques and customized treatment plans, individuals can achieve more natural and lasting results. Always seek advice from qualified professionals to ensure you receive the most up-to-date and effective care.